I was away on a family trip and randomly stopped walking and couldn't walk. And so it was then that it was found that I was having a crisis and I was diagnosed.
I think the unexpected nature of the condition, of course, adds to this. One day somebody could be fine, the next day not. Society just not being aware, you can just imagine how, it's perceived.
Trust is essential because healthcare professionals cannot give the best standard of care without knowing the patient.
Every time I sit in a room, such as this conversation with yourself, I hear something new. I take away something, I'm like, I had never thought of that before. Hi, I'm Rossby. I'm a doctor in the UK. I work within sickle cell, so I manage those who come in with what we call crisis pain. I'm also involved in clinical research and education as well regarding sickle cell. So, lovely to meet you. Tell me a bit about yourself.
So I'm Shaniqua. I am a sickle patient, HBSS. I am a patient advocate. I try to use my experiences to educate healthcare professionals specifically and wider society about sickle cell disease, and hopefully in raising awareness, driving change for better patient outcomes. I was diagnosed with sickle at 18 months, so I was not diagnosed at birth. So my mum must have had this screaming baby thinking, what's wrong with her? And not knowing. So I was away on a family trip and randomly stopped walking and couldn't walk. And so it was then that it was found that I was having a crisis and I was diagnosed. It's been a tumultuous journey since then. I've experienced a lot of ups and downs with the condition. It is a condition that is unpredictable and presents itself in any way that it so wishes, and I have to learn to navigate it and acquiesce to the needs of sickle, even when I don't want to, and so on.
So of course we know sickle cell, you're born with the condition, so you must have interacted with so many different people. How do you interact with people in relation to your sickle cell? Do you tell people about it? And how does that affect everyday relationships with people?
Such a good question. So if I'm honest, I try to be very open about the fact I have sickle cell for a myriad of reasons, but mainly because I think relationships need honesty and trust and so on, and a good way to build trust is to be honest. Also, every time I could tell someone I have sickle cell, to me, is an opportunity to educate and teach and raise awareness about the condition and encourage people to get their genotype checked. So I'm very open about having the condition, but there are constraints and limitations within that. It's funny because I haven't always been so very open about having sickle cell. And I think it's definitely a recent, within I'd say maybe the last decade or so, phenomenon for me to be so open about the illness. Part of it is culturally, as British people, we're very private, aren't we? It's not the norm to speak about health issues or issues otherwise, any other type of issue. It's not really the British way. The British way is to just kind of suck it up and persevere and push on. And so it's countercultural to be so open about my illness, and if I'm honest, speak to anyone that will listen. Anyone that will listen, I'll speak to them and say and teach them about sickle cell and how it impacts me and so on. But yeah, so far I'm pushing through and getting on. And so when I first began work as a patient advocate, my parents were not very happy. Why would I be telling people about potentially a perceived weakness or something that can be used against me? And it is something I'm conscious of. I never want to apply for a job and they see that I've got this illness before I've had the opportunity to, interview and present myself and so on. There's a real fear of, I guess, of ableism being kind of projected onto me. So though I am very open, I do share, I do so with particular constraints to protect myself, because we don't live in an ideal world.
Yeah.
I mean, there is definitely a merit to the issues of perception within wider society, but I would even challenge the loved ones of people who are around sickle patients to really think about the ways in which sickle impacts their life. Oftentimes you hear people say, oh, sickle cell's not that bad. My aunt's got it and she's fine. They don't live with the aunt. They don't know how she suffers day to day or how it impacts their life. And so when they just see how the aunt presents when, I suspect when she's well enough to, you know, go to family functions and all of these sorts of things. And so it's an illness that impacts everybody individually. And so it's different for each patient. And so it's really important, I would suggest to loved ones as well as healthcare professionals, you know, build that relationship of trust so that the patient can be open and honest, and try to have empathy for the ways in which, outside of the atypical, you know, pain crisis, the way the illness impacts other elements of life. I've been in scenarios where, you know, I try to sit down on the train, and because I don't look disabled, whatever that is even supposed to mean. I think often when people think disability, they think wheelchair. So because I'm not in a wheelchair, why am I sat in this, or I'm not elderly? Wheelchair and elderly tend to be the two things that people's minds go to. And that judgment of, and I shouldn't have to explain my medical circumstance to any stranger, really.
Yeah, and I think the unexpected nature of the condition, of course, adds to this. One day somebody could be fine, the next day not. And society just not being aware, you can just imagine how, you know, it's perceived. I can imagine how it's perceived, and I think that needs to change. We do need to have more of these discussions so people know, support one another, you know.
Absolutely.
So tell me, why is trust amongst healthcare professionals and those with sickle cell really important?
Oh, it's essential. Trust is essential because healthcare professionals cannot give the best standard of care without knowing the patient. And the patient can't be free to tell the healthcare professional all of the information they need to know about them without that trust being there. For sickle patients, there are so many different stigmas that can impact our lives and treatment options in the longer term. And so you'll find that patients might be reticent in sharing information. So having that trust there is absolutely essential. For me personally, I think I have like categories of trust. I almost have like a spectrum of trust. So I have my outpatient team who I've been with for decades, and I trust them almost inherently. And then on the other side of that, I have, I would say I have trust issues in the emergency care, you know, so presenting into A&E, any hospital that I don't know the staff or I haven't encountered the staff. I think I definitely start from a disposition of not to be trusted until they prove to me that they should be trusted.
So I think going off of what we've discussed, we'll talk about racial inequity. Or is there any racial factors that you think affects your care?
Often what happens is the negative stigmas that are projected onto sickle patients are often fueled by racial stereotypes. And sometimes even small things like, you know, there's a bunch of stereotypes about black people, specifically within the West, I guess, wearing tracksuits and those being, I guess, aligned to a criminal activity. And so I know that I've had experiences where I present in hospital in a tracksuit. Maybe I've had a crisis in the middle of the night, go into hospital, and I'm treated a particular way. You know, I could tell you countless examples of being treated one way if I present in a tracksuit, but if I have a crisis at work and I present in office attire, the treatment in the same hospital is so different.
That's quite a powerful thing you said. I'm very sorry you've experienced that. I can only hope that I guess healthcare professionals and organizations take this on board. You know, I know the introduction of things like the care plans hope to remove such human bias, you know, to give people an effective framework to enable to treat people properly, which is sad to say, actually, when you think about it. A lot of this, as we said before, comes down to trust, comes down to empathy, comes down to being people. We shouldn't have to dress up to come to hospital.
Yes. So as a healthcare professional, what do you do to address those unconscious biases, if you have any, and what advice would you give to other healthcare professionals to ensure that those biases that they have don't present in their treatment of patients?
So training and education is the most important way to get around this, I think. You're going to get a lot of people who come into a profession skilled with different ideologies. And what we need to do is, when treating people, the idea is that everybody should be treated the same. And that is actually one of the second ethical principles we discuss, which is called justice. No matter what race you belong to, what you believe in, or any individualized characteristics should be honored and respected in every scenario. There should not be room for anything other than that. And it's through the constant reinforcement and training is the only way I think we will get around it.
What advice would you give to healthcare professionals to build trust with their sickle patients, or tactics that they can do to solidify that trust and so on? What advice would you give those healthcare professionals?
So I say what's always worked for me has always been having open discussion with the person in front of you. If you are a doctor who is seeing someone for the first time, yes, you're there to treat what you're there to see, but you have to imagine this person has a life that has gone on way before you've met them, and there's a whole story behind it. So sometimes a listening ear alone goes a very, very long way. And I found that in my practice. I'm always, maybe I could take quite some time, but I do enjoy, enjoy maybe the wrong word, but I do take pride in the fact that I do like to communicate and understand what the problems are.
Yeah, I love that. When I think of all of the experiences I've had over the years, the ones that I would call like excellent care, really great care, all stem from the doctor listening and being interested in me as a person. You know, I'm not just sickle cell patient number 5 or something, you know. When I think back to all of the great care experiences I've had, that is definitely the common denominator. Listening doctor, I love that.
Yeah. And so what do you think is a powerful discussion, or discussions that should be had more between healthcare professionals and patients?
So the first thing is a holistic approach, because sickle impacts the entire life. It impacts me day to day, it impacts me year to year, decade to decade. Maybe I'm eating something that is causing me issues with sickle, and I have no idea, because I am not a nutritionist and nobody is studying what I'm eating or anything like that, you know. So that would be definitely one area I'm keen to see. And then the next would be how sickle impacts the little things and what can be done. So for example, workplace adjustments, right? There are so many sickle patients who their career options and or career trajectory are limited because of the illness, but they don't have to be. If people are aware, firstly, of the legislation in place to help them and to have reasonable adjustments in place, if healthcare professionals were willing to engage with workplaces and teach workplaces and sorts of things that can be done to help the sickle patient thrive in the workplace. So that's definitely a conversation I'd love to see between the patient community and the healthcare professional community. What can we be doing differently? And I would really like to see some further bridge building between the patient community and the healthcare community to build that bridge and ensure that sickle patients have the environment and the resources and the knowledge to live their best lives and have improved quality of lives and thrive ultimately. But I'm interested to hear from the healthcare professional's perspective, conversations you think would be key to have.
The experience of the patient for healthcare professionals, it does go missing, I would say. I think we don't get enough of that. Every time I sit in a room, such as this conversation with yourself, I hear something new. I take away something. I'm like, oh, I had never thought of that before. It's like I learned a whole new language. We can't be taught this in med school. Med school can only teach you so much. To actually hear what somebody feels with the condition and what they go through on a day-to-day, even the little nuances can change how you understand things.
Here's to hoping.
Yeah, exactly.
Hopefully they'll start to be had.
Yeah. and we need to come together, share resources. You know, I think, I'm sure you can talk to the fact that discussions with not just between us, but within communities, like even the sickle community. I'm sure there's discussions to be had.
Yeah, absolutely.
Look forward to seeing more of the work that you do as well, actually.
Yes, and me too. Hopefully you can lead the charge in bringing healthcare professionals on the journey with the sickle patient and seeing some improvements there.
I'll never sleep. You know?
Sleep is overrated. You don't need sleep.
I think the message is the journey. We work together, and come together.